I'm here to talk about depression because it is an actual illness and it can take away your life, your love, everything that you value. So, if you or your friend or anyone has those symptoms, please get help and take care of them. That is all you can do to prevent them from doing a suicide. So it is a real issue for most people, and they don't even realize that they had depression, but they lost their life because of a treatable illness. That's why you should get help instead of wasting your life. So let's first start to understand what depression really is. It's hard to describe because it's not like, oh, you have heart attack, you have cholesterol. It's not really visible, and you can't really show it with the result sheet like you have high sugar levels or something, but it is actually caused by chemical imbalance in your brain. A certain chemical called serotonin, and when you have low levels of serotonin, you are more likely to get depression. The signs include a lot of things that normal people feel in their normal lives, but it's extreme for a depressed person, and it can really affect their normal day-to-day life, such as loss of interest in daily activities like getting up in the morning, like your social activities, your hobbies, and things that actually gave you pleasure in the past, but you can't do them now because you lost interest. And sleep change, like either you have insomnia or waking in the early hours, or you can't get enough sleep, or you are oversleeping, like you sleep at the daytime. That is another sign. And appetite or weight loss. Some people actually gain weight because they have stress and they are trying to fight it with eating extra food, and some people lost their appetite that they don't bother to eat anymore. Sometimes depressed people feel worthless or guilty for even little things, like you should not bother about them, but you feel really ashamed of yourself, you feel guilty, you feel worthless, you feel you shouldn't even be loved by anyone, like you're a complete piece of trash. And you can't focus on things that you did normal before, like concentration problems and remembering things. You kind of lost a part of your memory, and sometimes you get like headaches, back pains, muscle aches, or stomach problem without any indication that you actually have them, like you feel like you have arthritis or something, but when you get checked you actually don't have that, but you feel the pain because that is because of depression, not because of a physical actual illness. Depression is major risk factor for suicide. The despair and hopelessness that goes along with depression can make suicide feel like it's the only way to escape this misery and this life. So if you have a loved one with depression, or if they talk about any like suicidal talks or behavior it's like actually doing that, these can be signs that they have depression. So if someone is talking about killing or harming themselves, maybe they have depression. And unusual talks about dying or death or how other people died, if they say things like everyone should be better off without me, I don't want to make you feel bad for me, stuff like that, maybe they are extremely depressed and thinking about. And if you had any early childhood trauma or abuse in your life, then you are more vulnerable to depression. And if you use alcohol or drugs, and if you have a family history of depression, then you are more vulnerable to depression than other people. What you can do if you have depression is reach out to your family or your trusted friends. When you feel like you can talk to them and get help. I really hope to make some more videos about depression and anxiety and how you can manage stress in your life. And so yeah, I hope this helped, and goodbye.